I'm going to welcome back our speaker today. Dr. Johnson is an associate professor in the Department of Psychiatry at UK with a joint appointment in College of Social Work. He did his undergraduate work at Tennessee Tech University, where he earned a BS in Technical Communications. He earned his master's and doctorate in social work from the University of Kentucky. Dr. Johnson is the Director of Psychotherapy and Psychological Services in the Department of Psychiatry. Besides seeing patients for mental health and substance use issues, he teaches residents and graduate students in mental health and psychotherapy techniques. He is also the coordinator of mental health services for the Bluegrass Care Clinic at the University of Kentucky. So welcome back, Dr. Johnson.
Thanks, John. It's good to be back with you. I guess we'll just go in with a few more housekeeping things. I have no relevant financial relationships to disclose that would affect the information in this talk. And if you were with us last week, these were the objectives that we tried to look at, and particularly with the unique challenges that we see in individuals who identify as LGBTQ that also have issues with opioid use disorder or any substance use disorder. And then we framed it with the idea of looking at possible reasons or causes, which, you know, it's difficult sometimes to find a direct causation for something. But there is strong evidence that minority stress, particularly gender or sexual minority stress, could help us understand why individuals are at a higher risk for opioid use disorder, as well as a higher risk for depression, other mental health disorders, and other substance use disorders. So hopefully we also then looked at ways to address minority stress in the context of working with folks with opioid use disorders. So we'll do a little bit more recap of what we talked about last week. So multiple studies have shown us that LGBTQ folks, as I just mentioned, have problematic use for substances. Particularly, most studies agree that it's probably up to 3 times more in this particular group of folks and populations than it is for people who identify as heterosexuals. So in other studies, we've seen that 20 to 30% of folks who identify as LGBTQ plus report problematic use, and that's compared to only 10% of non-LGBTQ identifying individuals. We also talked about particularly men who have sex with men or who identify as being gay men. There is a subculture of high use of alcohol, marijuana, psychedelics, other drugs, and these are particularly related to use in situations where there may be high-risk sexual behavior as well. So there's a strong correlation between party drugs, if you will, or getting a head change or getting stoned or high, that a lot of these individuals identify as something that correlate with sexual interactions with other men. And we also looked a little bit at the data on trans-related information. So this is even higher, I think, for this particular population. 26% misuse drugs or alcohol specifically to cope with what they identify as discrimination they face due to their gender identity expression. What we talked about as gender minority stress last time. And then this startling number of 51% of respondents in this particular study or meta-analysis reported attempting suicide, and that's compared to 1% in the general population. So there's a 4-time the national average of HIV infection in trans folks, as well as compared to 6% of the general population. We also talked about if we know that this is going to be a population that you will see and work with. We know that this is these individuals have higher rates of substance use and opioid use, heroin use disorders. That to work with these individuals, you need to know the terminology and use it correctly, or you risk rupturing the therapeutic relationship, hopefully, that you'll build with these individuals, these folks. So if it's something that you don't know, and it's okay if you don't, that you ask. It's important to, if someone uses a term you don't know, just if you're working with any of your clients and they may use talk about a drug that they use that you're not familiar with, or a way of using the drug that you're not familiar with, I hope that you will ask them, what are you talking about when you say this? Because if you don't know what they're talking about, you can't really help them out with their situation. So don't ever be afraid to think, oh, I'm too embarrassed to ask this because the client may think that I don't know my stuff or don't know what I should know. That's actually the wrong direction to go. And we all are continuing to learn, and we all are continuing to grow and understand what's happening. So when we're working with individuals from the LGBTQ plus community and there's terminology that you're not familiar with, or they say something that you have no idea what they're talking about, please ask them, because if you assume that you know what they're talking about, you may be missing something completely, and then that could lead to some problems. Okay. So part of the framework that we talked about last time as a possible explanation for the increased use of substances, as well as increased use in mental health disorder like depression and anxiety, and even history of trauma, is probably linked, or one of the reasons that we can use to think about why this may be a particularly higher number in this population, is this concept of sexual minority stress or gender minority stress. So we talked about minority stress in general is this idea that because of who you are, that there are certain stresses built into living in that as that certain individual, right? So living as a lesbian or gay man or a transgender person has its own stresses built in. So the questions are, will people find out about my sexual orientation, or will people find out about my gender? Will they be accepting of that? Will they think differently of me because of that? Will there be negative outcomes because of that? Will I lose my job? Will my family disown me? Will my church turn their back on me? Will my friends think different of me? Will I be physically harmed? We see that particularly in the trans community, that the risk of physical abuse is much higher for these individuals. And I'm sure you've seen in the news the terrible outcomes sometimes of folks that are physically assaulted because of their gender expression. And will there be fear and ridicule? In other words, what are people thinking about me? Are they talking about me behind my back? And what's that going to mean? So if that is constantly something that an individual is having to deal with, if that's something that's always kind of percolating in the background, on top of the regular stresses that you and I deal with on a day-to-day basis, you can see that that would probably increase someone's anxiety, depression. And what we know is that if people are depressed or anxious or dealing with other mental health issues, they're more likely to use substances as a way to quiet those thoughts, or as a way to treat the moods that they have, as a way to have a head change to get out of feeling the way that they're feeling. People don't use drugs because they feel great, right? Or because they're high on life. Usually people use drugs because they're seeking some kind of change, or seeking some kind of relief, or seeking some kind of break from the emotional or physical distress that they're dealing with. So if you think about these individuals having a higher level of ongoing stress because of their gender or because of their sexual orientation, it makes sense then that they would probably seek out substances to use to have some kind of relief from this minority stress. Okay. So some particular issues that we touched on last time that we talked were what I just mentioned, this increased substance use and mental health issues in this particular group of folks and population that they deal with. There's also increased risk of suicide, particularly in the trans community, but also in just the LGBT or LGB community as well. Internalized homophobia, this is a term that we defined as how someone feels about themselves. It's the self-loathing or self-hatred or self-deprecation because of their knowing who they are and not wanting to be that way. So it's before someone accepts their sexual orientation, or before someone admits to themselves that maybe they are transgender. So it's these feelings of cognitive dissonance. It's these feelings of, I don't want to be this way. It's bad to be gay and I don't want to be gay. So having to struggle with that internally, that internal struggle of knowing that you're different and knowing that you don't want to be that way, is this idea of internalized homophobia. So it's something that the individual is dealing with as far as acceptance of their own sexuality or own gender. And then we talked about the role of sexual abuse and violence briefly in the LGBTQ community, as I mentioned briefly just a few minutes ago, that this community, this group of people have higher instances of trauma, physical abuse, sexual abuse, and violence in their early life, as well as then in their relationships. So there is a chaotic element for many individuals here that we see that's higher than in the general population. And again, probably due to increased levels of mental health issues and increased levels of substance abuse issues. As we know that if you're abusing substances, it creates a somewhat chaotic life, which oftentimes leads to poor decision-making and may also lead to violence or abuse. And limited social outlets. Okay, now these are, I think, the questions that Chris and John put together based on what you sent in and based maybe on some of the things that we talked about. John, do you want me to just read through those? Is that how that works?
Yeah, you can do that if you'd like, I think.
Okay. So the first question was, given the difficulties that the LGBTQ individuals have had with healthcare providers and lack of training that many health professionals have in treating this community, what recommendations do you have for identifying safe providers for the LGBTQ plus community clients, for other health needs to refer clients to, especially if they are looking for a mental health provider to provide required letters of support for gender transition, to ensure, or to insurance providers to cover that gender affirming procedure or therapy? So that's a lot of question right there. So let's see if we can break it down just a little bit. So how do we identify safe providers? So I think in our clinic, what we do is, when folks ask for, and they sometimes call when they're seeking to get treatment, they ask for a provider who's LGBTQ plus friendly. And so that is how we handle it in our clinic. So if you're working in a place and you're open to seeing and working with these folks, let your intake people know that you're open to that. Hopefully most people in your treatment centers and in your clinics and in your agencies are open for that. If there's not, then maybe you can help do some work on that so people will feel more comfortable with it. There are also, I think, websites you can look on. The Psychology Today website that has mental health providers on there, and they will identify themselves as working with this population or being comfortable working with this population. Those are the two ways that I know, I guess, more so. Hopefully too, clients will ask their providers if they're seeing them for the first time about that. Thanks, Chris. There's a link there for that. I don't know if anybody else has any other suggestions. You can put that in the chat box, or you feel free to unmute and if you have other suggestions.
If others are interested, the one other resource that I'm aware of, there are a couple of groups that I'm not sure if they represent all Kentucky counties, but some, especially around Fayette County, that have put together provider directories that have mental health providers, but as well as other medical providers that are, affirming and provide gender affirming medical services. So if anyone's interested in the list or the groups that share those lists, I'm happy to share that. I'll try to find it. I'll see if there's a link that I can put in the chat, but if not, others are happy to reach out via email. I'm glad to provide those lists.
Yeah, that's really helpful. I'm on a Facebook group. It's the Transparent group for parents of transgender kids. And that, I know that group also has a list like Chris was describing that basically says, here are trans friendly therapists in the Lexington area. I think it's a Lexington group, but they may, if you're not too far from Lexington and folks are willing to come to Lexington for treatment, which I know some are, that would be a good way. But I'm sure there are other organizational groups like Chris was saying that have compiled a list of providers, both mental health providers and maybe even primary care providers, who identify themselves as being open and friendly to seeing this group of folks. So that kind of goes into the next question. How do we advocate, support clients when they meet with other healthcare providers, especially those providers have shown discriminative behaviors or client deems the provider unsafe to disclose their sexual or gender identity? I wish there was a simple answer to this question. I've had clients and patients who have come to me and said, my primary care person, asked me this question and said they didn't want to talk about this or felt, unfriendly about that. There are some providers who list themselves that way. I encourage folks to, if I know of someone that is covered by their insurance or their healthcare policy, or depending on where they are, I'll refer them myself, or try to, like Chris was saying, find a list of those individuals. And I don't know, other than, unfortunately, if you know ahead of time, to be able to give those names to people. And I would encourage you in your work, as you build relationships with primary care providers in your area, to maybe even go meet with them and talk to them about that. Ones that you think might be open or friendly to this idea, to say, hey, can I come by your office and us talk about this, because I see a significant number of folks who I feel like need this kind of care, and would you be open to seeing them? And if they say no, ask them if they know of anyone in their, specialty that will be willing to do that. So sometimes it's just about making some calls or making some visits, and building up that referral list that you have for clients. All right, our next question was, right now, it is especially difficult time for many LGBTQ individuals in Kentucky, particularly trans individuals, with the passing of this recent ordinance 150, which I think the veto was overridden yesterday, along with many other laws and things in the news and that we see what is going on, and that is absolutely true. So what recommendations do we have for starting a conversation with clients about how they are coping with these and other potential issues at present, and how that may impact their substance use? So this is a great question. And, I think my response is, if you're working with an individual right now who identifies as LGBTQ plus, I would say start the conversation with at the beginning of the meeting. How are you doing? Are you okay? There's a lot of stuff going on in the government and the news about what's happening. Is this triggering you? Are you feeling like this is increasing your anxiety? Are you feeling like this is a threat to your sobriety? Again, you're not going to push somebody to relapse by asking them if they're getting triggered by a stressor. So the more that you can get up front with this, the more that you can talk about it, the better. I had a patient emailed me this morning that has a transgender child, and they said, my kid is really struggling today. I don't know what to do. Is there someone that he can talk to? What can be done with this? And it's a really rough question. So I think a lot of people, children and adults, and your clients that are hopefully working on recovery are going to be really triggered by this. This is scary stuff, and it's very demoralizing. One of our residents who is transgender called in sick to work today, which is understandable, because it's just so overwhelming, and I don't think they have the capacity to deal with other people's issues today. So taking care of yourself, taking care of others, but for this particular question, yes, please ask about it. It's significant, and it's going to significantly impact many people. And if not directly, indirectly, like the message that I got this morning about their child. So people are stressed about this. This is, again, one of those things that I think maybe intentionally people were like, oh, I don't see how this could impact so many people. It will impact millions of people in our Commonwealth. So absolutely check on folks and check on to see how this may be triggering them with their drug use and their mental health. Any other thoughts about this? Others have anything they'd like to share? The next question is, what recommendations do you have for language and initial interactions with clients that may help LGBT clients identify me, the person asking the question, as a safe person to disclose their sexual orientation and gender identity? So I don't know that, language, obviously, telling your client that you're open to anything that they feel like they need to discuss. But I think maybe some nonverbal communication sometimes is even more important than the verbal communication. So I wear this badge that has this rainbow on it, which is sort of a subtle way to say, hey, I'm got this rainbow thing going on if you want to talk to me. There's also, a friend gave me another one that I don't know if you can see this or not, but it says, it actually has "you are safe with me" on it. It has a rainbow and the trans symbol at the bottom. So if you can get something like that, either a pin, or this is another way for a badge. Some people put rainbow flags on their badges, or even other things that let people know. I have in my office here, I have a rainbow flag that I keep up on my cork board right there, so that when people come into my office, they can see it. I encourage you, if your management will let you, to put either rainbow flags or rainbow stickers on your check-in window at your organization, at your clinic, at your treatment center, because having those things visible for people says immediately this is a place where we recognize that people may be concerned about it, and having this affirmation of a visible symbol of acceptance can be very, very helpful, either on you, in your office, at your check-in window, for people to understand that they're in a safe place. So I really like this question, and I hope that that's helpful.
If at any point anyone wants to follow up on a question or ask anything, or even just a different question, we don't have to go through these in order. So if there's anything that you're curious about or have questions about, please raise your hand, come off mute, send Chris or I a message, and we will make sure to answer that.
Okay, what rates of substance use misuse, with rates of substance use misuse being so high for this population, are there resources or programs that specifically focus on those that identify as LGBTQ? Are there online support communities or resources for people that have limited options in their community? So let me just start with that and say, in Lexington, we do have specific AA groups that are LGBTQ groups. that people can go to. Hopefully most 12-step programs, NA or AA, are welcoming of LGBTQ folks, because again, most of them realize that there's a high percentage of folks in the LGBTQ community that will need these resources. So if you have that possibility, again, I don't know if some people are willing to drive to Lexington to attend some of these AA or NA groups, but they are available. Online resources, there are pros and cons to online resources. So if you live in a rural community and there's not, it's too far to get to a place where there are supports for your clients, turning to online resources could be real helpful. So there are very legitimate sources out there for folks, and I think there are also interactive chat for folks that it can be really helpful. I know several of my clients during COVID attended AA meetings and NA meetings and recovery group meetings in other states, because it was a virtual meeting. So that has really opened that up, and I think that's fantastic. So finding those and being willing to, there's a group in Palm Springs, California that your client wants to attend because it's an LGBTQ group. So finding those and doing those is great. The cons of those are you never really know who you're talking to sometimes. So I've had clients that have maybe got on what they thought was a support group and have been attacked by other members. It's not funny, but for a place where they thought that they were supposed to be getting support, they actually, in particular, I'm thinking about some trans sites where people are like, "You're not transitioning right. You're supposed to be doing this," or there was you can't be transgender if you're not dressing the way you're supposed to every day, or that's not the order of transitioning, or just some where people were projecting their own issues onto other people. And it's really sad in a way, because individuals are reaching out for support, and instead they're getting bullied and bashed by people in their own community. And again, a lot of folks are dealing with all kinds of issues, all kinds of trauma, all kinds of personal damage. So running into these folks on support groups is not, unfortunately, uncommon. So being able to talk to your client, I usually try to say, look, there's good and bad in doing this, but it's just like anything else. You've got to find your people, you've got to find your community, and there are going to be people on there that may not be what you're looking for. There may be people on there that are not supportive. So be cautious and know that that's how it goes, because some of you probably have been on social media and you realize people can be ugly, as my grandmother would say. People can be, hateful. People can be accusatory. People can be downright vicious to other people. So, it's the same warnings that we give our children. Watch out on social media because there's some ugly, hateful people out there. So that's been my experience. So the next part of this is, with many behavioral interventions and mutual help groups, having a network of support is often important, but for some with unsupported families and communities, it can be hard to find support. So yeah, so again, looking for support online is a good way to go, but proceed with caution. And I don't know if anyone else has thoughts about that.
I did want to mention that I did put a link for smart meetings that are specifically for LGBTQ plus individuals. And so smart recovery is something that we've talked about here, and we've mentioned in previous KY Opens. So if that's something that you think would be helpful or a resource that you'd like to have handy, I wanted to make that available.
Yeah, thanks, John. That's great. And again, I don't want to come off too negative. That may have been a little bit harsh, but I think, there are great resources out there, and these legitimate meetings that are monitored and that people are, you know, aware of what's happening are great. It's the ones that are maybe are not so well monitored or sanctioned by a particular group. But like these smart groups, absolutely, that would be a fantastic resource for people to use. Just making sure that you sort of vet where you're sending people, and being, you know, maybe giving them a little bit of, you know, caution with that, because people sometimes their own issues can sometimes get in the way of what they're trying to do. But just like at an AA meeting or an NA meeting, right, there's going to be that one individual that monopolizes the conversation, or that one individual that says this is how you need to do recovery, or this is, you know, you're not in recovery if you're on Suboxone, all that kind of stuff that, you know, well-meaning individuals sometimes do. So, you know, the fact that we're human beings and the fact that there are human beings involved, that means there's going to be some issues from time to time. So, yeah.
I think the top part of this question got cut off, so
I was going to say, I don't know if I can see the top of that. But.
It should say, let me, I apologize. Let me see if I can. Here we go.
Right, harm reduction for chemsex. So chemsex is sex under the influence of some kind of drug, right? So, and you know, for men having sex with men, I think I touched on this last week and maybe a little bit earlier today, is there's a strong correlation for lots of our clients or lots of our patients who use substances as a prelude to sex or in conjunction with sex, and some who even say, I can't have sex without, you know, smoking some crack ahead of time. I have one fellow that I used to work with that was how it worked for him, is that he had basically reduced his sexual encounters to only having sex after he had smoked cocaine. So they were linked together for him in his mind in the way that he worked. So it is a big thing, and as we know, when people are under the influence of a substance, they don't always make good decisions either about partners or about safe sex. So, you know, again, this is something you should jump right in there. Jump right in there with your clients and with your patients and say, let's talk about sex a little bit. This is, you know, this is an area that sometimes counselors and therapists and providers shy away from. But it's an important area, particularly with this population who are at risk for STDs, higher risk for STDs and HIV, to talk about this with your clients and patients. So I always tell when I'm training, you know, social workers and working with our residents, you have got to talk about sex, and you have got to be comfortable talking about sex, particularly in this intersection of substance use. Because, you know, again, if that's the norm, if that's the regular, you know, you're dealing then with another issue that you need to figure out how you're going to help this individual not use or abstain from using substances while they're having sex. And that may mean, you know, you need to back up a little bit and figure out what their sexual habits are and ways that you can maybe offer some behavior changes that don't trigger them into using drugs every time they have sex or when they're seeking out a particular kind of sex. So yes, I always tell folks, you know, you can ask any question that you want. You know, a client can always say, I don't want to answer that. But if you don't ask it, then you're not going to get the information. The caveat here is you don't ask about people's sex life unless it's relevant to helping them in treatment, right? So don't be nosy about sex life, or how does that go, or how does that feel, or, you know, that kind of stuff. Those are questions that are off limits for you because that's not helping you with an individual. But asking them about behaviors, right, of when do you use drugs, how does this usually happen, what's going on when this is happening, all legitimate questions to help you as the provider, as the counselor, as you know, the social worker, to understand what their behaviors are so that you can help them with either a behavioral intervention or just raising their insight and looking at what's going on with individuals. Now, I am happy to talk about this as long as you want. This is an important area, so please do not be shy at asking any questions, either through John or Chris or through the chat box, or feel free to unmute and ask them if you want about how to proceed with this or what things are appropriate to ask or not ask. I'm happy to talk more about it.
We just had someone in the chat kind of make a comment that heterosexual adults in the United States receive minimal sex education, and that but for LGBTQ adults, it's usually far less. I just thought that was an interesting point. So is there like a harm reduction resource that's specifically for LGBTQ plus individuals or something like that that could be helpful in this area?
That's a great question, and I wish I knew the answer to it. I showed, I think, that SAMHSA guide, and I think in that particular guide, it had some ideas about harm reduction as well. But again, even, working on when you're talking with someone to say, as you would with any harm reduction, right? It's like, here's how I usually frame it. Let's do an experiment. What I'd like for you to do is the next time that you're going to go out with your friends and you feel like this is maybe to the bar, or, that you're going to hook up with someone, what would it be like if you didn't drink before you went? Is that a possibility? Or what would it be like if you didn't do a bump of cocaine before you left your house? Or what would it be like if you didn't, eat a pill before you went out or sex? Have you ever tried that? What's it like when you do that? So again, you're getting this feel for, is it even a possibility? And then say, well, let's try an experiment. If you normally drink, 6 beers before you go out, and then you have a bump of cocaine before you go out to the bar, why can we try just 2 beers and no cocaine to see what that's like when you go out to the bar? Or, what would it be like if you decided before you went to the bar that you weren't going to use any substances and just tried that and see what it was like? And then you come back next time and talk to me about it, and we can talk about how hard it was. So anytime you're doing any kind of harm reduction, I love framing it as an experiment. I love, and even, you could throw a little motivational interviewing in there, which would look like this, to say, so, what you're telling me is that you sometimes feel guilty about, when you get high or when you're, using, that you end up picking up people and having sex with them, and then you feel guilty about it the next day, or you wonder if you've done something that you shouldn't do. So, you're telling me that that's an issue for you. What do you think? Is there anything you could do before you go out that might help in this situation? So there's motivational interviewing to say you're setting up this discrepancy with them, right? You're telling me that this is a problem, but you're also telling me these are the behaviors that you're doing ahead of time. Is there something else you could do? Is there another way to do it? And let them come up with it. Let them come up with the experiment. And you say, yeah, that sounds interesting. I wonder, how hard would that be for you to not have, not use drugs when you're at the bar? Or have you ever been to the bar where you didn't? And how was that? How were you successful at not using drugs that one time that you were there? And just, again, don't be afraid to problem solve. Don't be afraid to ask questions. Don't be afraid to say, well, what would happen if you did this, or if you didn't do that? Or is there a way that we can break this cycle of what's going on with, sex and drugs together? I don't know, any other thoughts on that? Okay, so with suicide and self-harm being more prevalent in this population, particularly with trans people, what care providers, peer supports, and others working in this field do to help someone struggling with these issues? This is a really good question again too, and I think it sort of encapsulates, everything about this talk, is that you know, what I want to accomplish with this is letting you know, and you probably already knew this to some extent, that this population is vulnerable, right? And so they may need a little bit more support. They may need you to go a little bit farther with them in offering them a safe place to talk about things, a willingness to open up, to let them open up about what they need to talk about, helping them find the support that they need, and help them feel comfortable with anything else that they want to talk about. So one of the things that I remind my LGBTQ plus folks with is, you know, I say to them, you know, we talk about a lot of things in here, and everything that you and I talk about is confidential. And I want you to feel comfortable talking with me about anything you want in this judgment-free zone, because if I don't know what's going on with you, I can't help you figure what the best next step is for you. You know, and then I explain the limits of confidentiality, that if they're, you know, going to hurt themselves or hurt someone else, that I can't keep that. But anything else that's going on, if people aren't in danger, that it's okay for us to talk about, because we're on the same team, right? We're trying to figure out what we can do to foster recovery. We're trying to figure out what we can do to keep people safe. We're trying to figure out what we can do to decrease the stress that's causing them to abuse and misuse substances. So yeah, I think that's the best thing you can do. And again, I'm happy to put my email in the chat box. I'll do that at the end. And you know, if there's particular questions that you have, I'm always happy to get back with you and share, you know, whatever resources I have or whatever knowledge that I have. But you know, I think what Chris and John have shared today too are also very helpful resources.